Thank you for providing me this opportunity to discuss my research project. This GU ASCO, we got the opportunity to present our study where we compared the tumor genomic landscape in patients with metastatic urothelial carcinoma with and without squamous differentiation. Urothelial carcinoma is one of the most common histological subtype of bladder cancer. Urothelial carcinoma can occur alone or in combination with various histological subtypes. Squamous differentiation is one of the most commonly reported histological subtype for urothelial carcinoma. In this retrospective study, we tried to explore the genomic landscape of patients with metastatic urothelial carcinoma having squamous differentiation and patients without squamous differentiation. For the purpose of this study, we included all patients who had the diagnosis of urothelial carcinoma and who had an available comprehensive genomic profiling from a CLIA certified lab. We divided the patients into two cohorts. That is, the first cohort was the urothelial carcinoma with squamous differentiation, which included patients with any degree of squamous differentiation found in their histopathology, and the other group had patients with urothelial carcinoma without any subhistological subtype. So this group was essentially pure urothelial carcinoma. We found that 87 patients were eligible for our study, where the squamous differentiation cohort had 31 patients and pure urothelial cohort had 56 patients. Our study found that the highest number of genomic frequency reported in the overall cohort were reported in TERT promoter, TP53, and CDKN2B. Further, we found that the cohort with squamous differentiation had highest number of genomic alterations reported in KMT2D, which is really significant, with 48.4% in the squamous differentiation cohort when compared to 0% in the pure urothelial cohort. We also found that the genomic aberration in CUL4A gene was numerically higher in the squamous differentiation cohort when compared to pure urothelial cohort. Our studies found that the patients with urothelial carcinoma with squamous differentiation had higher number of genomic alterations in KMT2D and numerically higher number of alterations in CUL4A gene. KMT2D gene and CUL4A are genes which are involved in chromatin remodeling, and our study suggests that epigenetic dysregulation may play a role in the pathophysiology of squamous differentiation. Further studies need to focus on transcriptomic profiling in order to explore this further.